And we're back now, 9:15. The term mental illness may pop into your head when hearing about mental health, but the two don't necessarily mean the same thing. Dr. Brent Wallis from People's Health, he joins us here to talk about why it's important to make the distinction between mental health and mental illness during Mental Health Month. And thanks for being with us. You know, when you think about somebody with mental health or mental issues, you think of somebody who's crazy, but really there are so many different types of mental illness out there. Kind of break them down for us, and then we'll talk about maybe some treatment and ways of recognizing it.
Sure. So, I mean, I think the first point that's important to notice is that mental health is essentially your physical well-being, your emotional, psychological, or social well-being. And so everyone has a certain level of mental health, and not everyone has a mental illness. So mental illnesses are things you think about like clinical depression, bipolar disorder, post-traumatic stress. There's a whole bunch of them, and those are a different category that actually often require treatment.
Right. Many times people say they know somebody who may not be mentally stable, and you say, boy, he needs help. He's got to go talk to somebody. And many times that's the truth, but you don't know how to step into that arena to not insult that person, but you're really trying to help them. How do you get to that point?
Well, it's definitely a touchy area, and so what I usually recommend is that a family member definitely needs to be involved, but they don't necessarily want to be the ones making the diagnosis. And so it's really important to utilize your primary care physician. They have some tools that they can use, some assessments that they can do to evaluate a patient. And one of the things that we look for in particular is sadness. You know, people get sad and they react to things that are going on in their lives, but when you have sadness for over 2 weeks, where you really don't know where it's coming from and what to do about it, that's a time when you should definitely talk to your doctor about it.
So when you talk to your doctor, what would be the next step? You go to your primary, and, you know, we talked before, you have high blood pressure. Well, you know, I heard, you know, it's inherited. But with mental health, it's something that you really need to take ownership of, and you need to get help. But when you get to that next point with your, say, primary, it's private, he recommends you to somebody. What is the next step?
So, you know, a lot of people don't realize that primary care physicians treat over half of the mental illness that's out there. And they're very well equipped to talk with you about what's going on with you, and they also understand where you need to go when they're not capable of taking care of it. And so at times they may recommend a mental health specialist.
Sure.
You know, and there's a stigma associated with that, unfortunately, and there really shouldn't be, because going to see a mental health specialist is very important. It means you're taking control of your health.
Absolutely. Well, a lot of people with mental health have suicidal thoughts, and let's put up the graphic now. Tell us about, we have a program coming up. So with that, 1-800-273-8255, and of course, if you have any information that you need to know, you can call that. So within that number, tell us what happens.
So it's so anytime it's escalated to the point where you feel hopeless and you feel like you can't do anything, it's very important to reach out at that time. There are situations in mental health where you can't personally cope with it. You may need medications, you may need professional therapy. And so especially if you feel like you may want to harm yourself or even someone else, it's important to reach out, and you can call the phone number to talk with someone about that.
All right, Dr. Brent Wallis, thank you very much. Great information. And, you know, hey, we all have issues, and just go talk to somebody if you need to.